I'm Tom Harrington. I'm the director of the Adult Hematology Sickle Cell Clinic here at Jackson and at the University of Miami. I've been doing sickle cell care for over 20 years. I got interested as a fellow with Dr. Temple, my mentor, and I took over for him back in the 90s, and it's been just a great opportunity to take care of people that deal with a lot of serious medical problems and also deal with a lot of serious misconceptions among caregivers and nurses. Well, the most common thing that brings them to the hospital is certainly pain, and it can be very severe pain. It's also pain that's not measurable. There's not a blood test that shows it, not vital signs that show it. The person has to state where their pain is, and doctors and nurses have to understand and believe the pain and treat it appropriately and treat it quickly. So pain is a major problem, but it's not the only thing. On a day-to-day basis, patients are struggling with stress and depression and anxiety about their disease, where they may feel good one moment and terrible the next. It's a very psychologically draining. From a pediatric standpoint, the studies showing transfusions for people with high transcranial Doppler speed, what's called a STOP study. That's made a major difference in preventing strokes in kids, helping them get to adulthood in a good functional state. The penicillin early on in life, preventing pneumococcal sepsis, has allowed a lot of people that otherwise die as children or suffer major complications as children. Since the late 80s, we've been using hydroxyurea, which has been a major help for many patients. It's not used as often as it should be, and it's not as effective in some patients as others, but it is a very important drug for many patients. However, recently we've had new drugs come out. It's long overdue. We're finally getting some newer therapies that can improve the lives and maybe allow them to stay out of the hospital and be more productive and happy in their day-to-day life. People like Melanie and others who are very informed about their disease and can be advocates because they've experienced it, they've experienced the difficulties with caregivers, they've experienced the pain, they've experienced loss, but they can understand where other patients are just suffering. The best way to do that would be to contact my office. I'm not on Facebook. I'm an ancient known, but the University of Miami has a web page that has my office in here. We can see patients both at the University of Miami as well as Jackson. I'm also glad to just talk to patients and see what they need and work with their primary care physicians or the hematologist if necessary. Well, Dr. Serjeant is a huge figure in sickle cell. He came from England to Jamaica many years ago, saw a need for better organized and complete care for sickle. A successful model for the entire island, where he established criteria. He taught people around how to take care of sickle cell patients, educated patients how to take care of themselves. And Jamaica is not such a tiny little place, but he was able to use great organization to sort of tie the care and the whole island together. The United States is a bigger issue, but and to model ourselves on how someone who organized care for far-reaching areas of the island and he's seen as a leader for all of us. His scientific knowledge, his medical knowledge, his medical care are world famous.